Did you ever imagine there'd be a shot that could take years off your face? Well, that's the promise of Botox. But does it really work? Is it safe? Dr. Kirk Brandow is a world-renowned cosmetic surgeon with some strong opinions about Botox. Let's find out what he thinks. Welcome, Doctor.
Thanks for inviting me.
Tell me something about Botox. Isn't it a form of a toxin?
Yes, Botox is a toxin that can be quite poisonous in a very concentrated form. However, in the dilute form that we use it in, it will bind with the nerve endings and slow down the release of energy that causes muscles to contract. And so we primarily use it not to actually paralyze muscles, just to weaken muscles in certain spots.
Where are the most effective spots? I know that it's the forehead somewhere. Is it this way or this way?
Well, you can use it in both places. But we also use it in other areas, such as like the crow's feet when people smile and they get those deep lines there.
Yeah.
I also use it just underneath the eye when people have little wrinkling of their skin from the muscle contracting, and also on these funny little lines, we call them bunny lines, when they squint and their noses wrinkle up.
Yeah.
You can use them there also. But people are starting to use it also for some of the lines around the mouth, for banding that some women or men will get in their neck.
Do you find that more people are using this technique than having facelifts at this point?
It depends on the age group. In the 35 to 45-year-old patients, we might do things like Botox, fat transfers to like the laugh lines or to the lips and to the cheekbone area, which tends to thin out. And then in patients who are older who've had facelifts, if they have a lot of wrinkling of their foreheads or their eyebrows are a little droopy, sometimes we can use Botox in order to soften those areas so they have a more even appearance of their face.
Sybil Rabinowitz, a former model, attributes her appearance to minor cosmetic procedures and Botox.
When I met Kirk, I was 52, and actually in a couple of weeks I'll be 64. And what he's done for me is that I could maintain a healthy, natural look and, you know, age kind of gracefully, but not look like I was artificial.
It is several injections.
Right.
We drop a small amount of the solution that we mix up fresh each time that we use it. And then I like to put on some numbing cream. And we wait for about 10 or 15 minutes. And then we inject very little small droplets into each one of these places. And I do a little massage of it to help it to disperse a little bit better. And then after we do it, we put on some ice on the patient's forehead or around their eyes. And then after it's done, what she'll want to do is squint and raise her forehead 20 or 30 times an hour for the next 2 hours, which helps the Botox to get absorbed into the muscles.
What are the risks and the possible side effects?
If Botox is not injected specifically in the right area, especially in the forehead area, it can cause drooping of the eyebrows.
That's
Completely
temporary,
shut.
isn't it?
Yes, it only lasts for about 3 to 4 months. The Botox, after you inject it, takes about 3 to 7 days until it reaches its maximum effect.
What do you think about these Botox parties that we read about in the newspaper?
There's a lot of peer pressure to get it. And so you put a lot of people together and they may say, you know, do it, do it, do it. And then you end up putting the Botox sometimes in the wrong spots. You can't ensure also who's going to be doing it, like the qualifications of the particular doctor who are doing it. And then I think the one-on-one interaction between the doctor and the patient, which is so important to understand their, you know, concerns and what they're hoping for.
Well, thank you for giving us so many facts on this popular procedure.
And thanks for inviting me.
For more information on Botox and other non-surgical procedures, why don't you write to us at the address you see on your screen or visit our website. Thanks for watching, and I'll see you next time. I'm Suzanne Roberts.